How will you spend your holidays? Will they be festive or blue? Stay tuned to Health Watch for helpful tips on how to improve your holiday cheer. Hello, I'm Terrence Saffer Anderson, and this is Health Watch. What colors come to mind when you think of the holidays? Crimson, red, forest green, snow white? Well, for many of us, the holidays turn into a depressing blue. We get the holiday blues. Mental Health America defines the holiday blues as a time of self-evaluation, loneliness, reflection on past failures, and anxiety about an uncertain future. They further advise that the holiday blues can cause stress, fatigue, unrealistic expectations, over-commercialization, financial constraints, and the inability to be with one's friends and families. Additionally, feelings of anxiety and tension are made more intense by family gatherings and parties, as well as demanding, exhaustive shopping excursions. Many people also develop stress responses like headaches, excessive drinking, overeating, and insomnia. Yet even more endure the post-holiday letdown. That is, after the joy of the holiday season has abated, launching into the new year with new and/or continued challenges. More often, the letdown is a consequence of disappointments that have occurred, exacerbated by the stress and fatigue brought on by the season. So as we prepare for the 2011 holiday season, Health Watch wants you to make it especially rewarding, fulfilling, memorable, and stress-free. We want to help you escape the holiday blues. To that end, we have invited two mental health experts on board to help us navigate through the season. Please join me now in welcoming Lynn Allison and Dr. Lawrence Ross. Lynn is a licensed clinical social worker and is the suicide prevention coordinator at the Hampton Veterans Hospital, Veterans Administration Hospital, and Dr. Ross is a licensed clinical psychologist and is the president of the Affiliated Clinical Therapists. Welcome to Health Watch.
Thank you, Terrence.
I'm so glad to have you on board.
Thank you.
Now, Lynn, I made a reference to some of the risk factors that are related to depression. But can you tell us what we could look out for, as well as look out for some in our family members? What are the symptoms?
Sure. My grandmother, interestingly enough, used to say when people would say they were depressed, she'd say, well, you're just helpless, hopeless, and hapless. And
thank God for grandmother.
Yeah. Well, you know, and it's great. It's not technical terminology, but she's absolutely right. I mean, things that we notice is that people that are normally pretty happy at this time just can't seem to be happy. They're hapless. They you know, things that bring them joy no longer bring them joy. They're not interested in maybe doing the shopping or the decorating or the cooking or any of the other things that they used to love, they're not doing. So that hapless, unhappy feeling that they can get around the holidays. Sometimes people are feeling helpless to make themselves feel better. I can remember my mother-in-law saying, you know, I'm just trying to feel better. So that helpless, I have no control, I feel trapped, there's no way for me to make it better. And then that can lead to a sense of hopelessness, that there's just no point, there's no future, you know, it's never going to get better. So those things can also manifest themselves in behaviors such as, you know, isolating, crying, sleeping more than usual, eating too much or too little, you know, feeling guilty all the time. There's a lot of, you know, things that can go along with those general feelings.
Are the symptoms any different for children than they are for adults? How do children manifest depression?
Well, children aren't as verbal as adults, and sometimes adults, when they're depressed, aren't verbal, but it depends on the child's age, their developmental stage. Really young children that might be feeling depressed often show regressive behaviors. They might go back to thumb sucking or wetting their pants, more irritability, not just when they're hungry or tired, but just constant irritability. Kids of school age sometimes start acting out. They'll start hitting or throwing, having anger outbursts. But again, they can have sleep difficulties or eating problems. In preteen and teen children, a lot of times we'll see acting out behaviors such as drug seeking, you know, problems with authority figures like parents and teachers, and all of the above. Again, you know, eating disorder types of indicators, sleep problems, those sorts of things.
What about the military? The folks in the military and veterans as well already have so many pressures on them. Do you see any difference in how they manifest depression?
How they manifest depression? Well, we give the same warning signs when we're talking to them. When we talk about caring for yourself, the warning signs are the same, but certainly there are different stressors and pressures that military families experience sometimes than others, you know, if they're apart from one another and that sort of thing.
You know, during the holidays, a lot of people, of course, reflect on the loss of loved ones. What can you, what insight can you share about that?
That's true, but you know, I guess I think about it, everybody. I think at the holiday time, it's a family time typically. We're thinking about family, we're getting together with family. And even though we're excited to see those people there, we're all missing people that used to be there, whether it's grandparents that are no longer with us, or parents, or cousins, or brothers or sisters, or close friends. And there's lots of reasons why people may not be present with us. It could be a death. It could be they couldn't get home for the holidays because of transportation or snowstorms. Could be that they're overseas deployed. And they could be in a variety of settings. So there's a lot of separation and loss that all people contend with during the holidays.
How serious a situation are we talking about here? How are there, let's say, the number of people that get depressed during the holidays? Is this something that you see a lot of?
It's interesting when we talk about depression. Sometimes the natural follow-on is, you know, are people maybe going to be suicidal? People often think that people are more suicidal at the holidays, and actually that's not true. The most common months are in the summer months. But I think when there is a death at the holidays, or a suicide at the holidays, it's so much more amplified for us, because that loss during a time of celebration is more painful to bear at times.
That's interesting. I had no idea that there would be a greater incidence of suicide during the summer months.
We think it might have to do with social context, that sometimes in the summer months people don't have as many social connections, especially people like in college or school, whereas holiday times is usually a gathering together of people, not only families, but there's a lot of other social activities going on. And so there's more chance to interact with other people to lift spirits.
Now, we're going to put some coping tips up on the screen from Mental Health America. And Dr. Ross, do please feel free to chime in at any point here.
Okay.
If someone, let's say that we recognize that we are having some issues, what kind of coping tips can, I mean, you don't have to list all of them, of course, but what kind of coping tips do you suggest?
Well, one, of course, is about not having unreasonable expectations for yourself or others during the holidays. You know, managing your time, managing your schedule is a good thing to do. Prioritize. Being realistic about what you can and cannot do. There's a lot of pressure on all of us in the holidays to make that special dish, add a new dish, you know, decorate better than someone else, you know, buy expensive presents, and so just, you know, being willing to set some limits and take care of yourself. Also remembering that the holiday season does not banish reasons for feeling sad. It's really important to give ourselves permission to be sad and to miss those that aren't there. There's nothing wrong with that. You know, that we need to balance that. We don't need to mire in it, but that's something that's normal. You know, leaving yesteryear in the past and looking forward to the future is important. But we don't want to forget the past either. So again, it's about trying to find some balance, remembering things past, and being thankful for the people and the events that have brought us joy in the past, but looking ahead to the future. We don't want to compare ourselves to yesteryear. So doing things for others is really helpful too. You know, getting outside yourself so you're not, you know, isolating and closing in on yourself. You know, find a place to volunteer, or, you know, make costumes for the church play, or whatever might be helpful, you know, to you, and connecting with others. Enjoying activities that are free. You know, we worry about the finances in our current economy, and there's a lot of things that, you know, that are free. You know, going, walking, seeing the lights down at Virginia Beach, for example, or you sound like you might have had something to throw in there.
I think some additional tips might be make sure you get some fresh air and sunshine.
Absolutely.
People forget about the easy things to do, going outside, taking a breath of fresh air. I think maintaining your exercise regime is very important. Exercise produces endorphins, which make us feel better. They lift our mood. I think it's very important to maintain structure during the holidays. That structure is comforting for us. Routine helps to ward off anxiety. It helps us to keep us steady. Along with that, I think it's important to go to sleep at the same time and wake up at the same time.
Well, if I could just do that.
Yes. Make sure you're getting enough sleep, at least 8 hours. And we talked about not using excessive alcohol, but also not overeating or eating the wrong things too much, because if we gain weight, that can cause stress and depression after the holidays. And also to watch our budget, because we tend to overspend during the holidays, and then we get our credit card bill in January and we become depressed and financially strapped. A couple of things in terms of if there is a recent loss, I would suggest to start a new tradition. Light a candle for the person who is missing, or have people around the table each tell a story about that person, a favorite story about that person, and that brings them here with us.
Yeah.
I recently lost a professional acquaintance who I use as a musical director. I've done a fair amount of theater, and he passed recently, and Facebook, people are posting all kinds of things on Facebook, and it became apparent to me that listing those memories is very therapeutic to a lot of people. I want to talk about clinical and medicinal interventions for depression, but before we get into this much further, let's talk. I mean, we talked about a bunch of different things here, but what causes depression?
Well, I think there are two basic things that cause depression. There's exogenous depression and endogenous depression. Exogenous depression has to do with things in the environment that make us depressed. If a girlfriend breaks up with us, or if we get divorced, or if we're being bullied at school, or if we lose our house. These are external things in the environment that cause us to become depressed. Then there's endogenous or internal depression, which has to do with genetic factors. And these genetic factors have to do with deficit of certain neurotransmitters, specifically the deficit of serotonin or the deficit of norepinephrine. These two types of depression can coexist, but it is true that people who are biologically depressed don't necessarily need the external stressors in order to be depressed.
I see. Is there a difference, or how do we make the distinction between clinical depression and someone just feeling temporarily sad?
I think there are three primary ways to distinguish clinical depression from sadness. The first is that clinical depression involves a syndrome of symptoms that occur together, and we talked about some of these. Not only feeling sad, but lethargy, not being motivated, difficulty concentrating, difficulty focusing, becoming more agitated, sleep difficulties in terms of sleeping too much or sleeping too little, things of that nature. These things co-occur. The second thing is that in order to make a diagnosis of clinical depression, there's a time factor involved. So you have to experience these symptoms for at least 2 weeks, and usually it's much longer than 2 weeks. And also, another important thing is that these factors or symptoms have to be strong enough that they're impacting our functioning in one or more environment. So in other words, it's stopping us from doing our best job at work, or we're going home and we're being irritable with our wife or our children, or in school we're not being able to concentrate on our work. Sadness, on the other hand, is a much more simple thing. It's much more transient. It lasts sometimes hours or a day or two. And it's only one simple symptom, which is the sadness, and it doesn't significantly impact our life the way that clinical depression does.
Yeah, I want to take a moment here to acknowledge someone who I have another question. That's someone that helped me identify you to come on to the show. Shatata Floyd-White at the Hamptons. She's a board-certified psychiatric nurse at Hampton Veteran Administration Hospital. And one of the questions that she wanted me to ask, and I'll ask you, Dr. Ross, is temporary Axis 1 diagnosis.
Okay. Well, the way that we make diagnoses these days is by using the DSM-4, which is the Diagnostic and Statistical Manual of Mental Disorders. And this is a multi-axial system using 5 different axes. Axis 1 is the clinical presentation, and this can be depression, anxiety, ADHD, psychosis. Axis 2 is personality disorders, which are such things as narcissistic personality disorder or borderline personality disorder. These are characterologically built into the structure of our personality, and they are there long term. Whereas Axis 1 disorders, they may come, they may last for a while, but then they go. Or they can reoccur, but they're not like personality disorders, which stay there forever, because they're based on the structure of our personality.
I see. I want to make sure that there's one thing that we get to today. And as I was preparing for the show and doing some research, I found a depression screening quiz on WebMD. So I'd like to take a moment and go through that quiz. There is actually several statements that are listed, 10 different statements, I believe, and the response is yes or no. And I would encourage our folks in our audience to take this quiz along with us. So I will do the first 3 and have you do the next 5, and then I'll close here. So why don't you take this quiz with us, but please be reminded that this is a simple online depression screening quiz. If you have any concerns about your own answers to this quiz, you should consult with a mental health professional for further analysis. Okay, let's get right into this now. I'm going to find my first couple of statements here. I feel sad or down most of the time. I've lost interest in the activities I used to enjoy. I feel tired almost every day. And again, these are yes or no responses, and I don't know how many people are going to follow us, but let's hope they do. So if you would please read the next 5 statements, Dr. Ross.
I have problems sleeping. I'm either sleeping too much or staying awake at night. My appetite has changed. I'm not eating enough or I'm eating too much. I'm having trouble concentrating. My friends say that I'm acting differently. I'm either anxious and restless, or I'm lethargic. I feel worthless or hopeless.
The final 2 are I'm having frequent headaches, stomach problems, muscle pain, or back problems. I find myself thinking a lot about dying. That's rather tragic. And that, I guess, if someone is thinking particularly about this last thing, they have a severe case of depression. And we can take a moment, again, off the script. We were talking about going off the script earlier, for you guys, either one of you, to respond to this particular quiz and the kind of statements, what that means when you respond to positive to some of these things.
Well, you mentioned thinking about dying, and that's certainly important. If you have a lot of other symptoms and you have thoughts of dying, it might be important to ask the question, have you had thoughts of killing yourself? Have you had thoughts of suicide? But it's also important to know that most people at times do feel like maybe the world would be better off without me. It's not an uncommon thing to think about, you know. Even children, you know, they have a fight with their sibling, well, you'll be sorry when I'm dead. I mean, these kind of comments get made, and people, you know, when we're really down, we sometimes question the value of our life. So that's not unnormal, but if you have a combination of factors and those thoughts, and you're feeling that hopelessness, then we need to ask the question to make sure they're not suicidal.
Sometimes it's the thought, and then also the intent to carry out the thought, and then the means to carry out the thought.
Yeah, access to means.
The thought itself is diagnostic, but not as diagnostic as an intent to act on that thought.
So we talked about different manifestations of depression, behavioral, emotional, mental. So that suggests that there are probably a bunch of different treatment modalities. And let's talk about those modalities by starting out understanding whether or not depression can be successfully treated.
I think depression, of course, can be successfully treated, and especially at this point in our history, never before have we had as much success treating depression as ever before.
Our medicines are better, our therapeutic modalities are better. You know, we talk about evidence-based therapies. So yeah, we learn, we're still learning, we learn all the time, but we're getting better and better. So I'm very hopeful about treatment if people will come and, you know, let us know they're hurting and give us the opportunity to connect them with, you know, services that can help.
Let's talk about the clinical interventions, the clinical treatments, if we can just briefly review those. Dr. Wells?
Well, one of the things that we want to look for is repetitive patterns that negatively impact the person. Does someone continue dating someone who's emotionally unavailable over and over again? We want to look at the thought patterns of people. Are our thought patterns negative and self-defeating? Do we always see the glass as half empty rather than half full? We also want to uncover traumatic emotional experiences that have either been repressed or that are impacting us in a negative way. We want to work through those experiences so that we could have more energy for productive things in life. And basically, we want to offer corrective behavioral, emotional, and cognitive experiences for the person so they could have a fuller and richer life.
And medicinal interventions, what type of medicines are?
Well, the medicines these days are very good. I think I mentioned before that there are two types of possible neurotransmitter deficits for people who are depressed. The first is serotonin deficit. For those, we give selective serotonin reuptake inhibitors, and you'll recognize these names: Prozac, Paxil, Zoloft, Celexa. And then for people who have a deficit of norepinephrine, neurotransmitter, we give selective norepinephrine reuptake inhibitors, and the most well-known of those are Wellbutrin and Effexor. And now we have a new class of medication that is a combination of SSRI and SNRI for those who have a deficit of both neurotransmitters, and those medications are Pristiq.
I've seen those commercials.
Right.
Yes.
You have to wind yourself up
Yeah,
going in the
right.
morning.
And Cymbalta.
Right. Now, it's interesting. Wellbutrin,
Yes.
if I'm saying that correctly, isn't that also used for smoking cessation?
It is. It reduces cravings. It's used in different dosage for that, but it reduces cravings for smoking and also reduces eating behaviors in some cases as well.
Okay. I noticed in doing research for the show that there's something called seasonal affective disorder. Does that expressly apply during the holiday season?
It can. It can. It most commonly does occur in the fall and through the winter. And
So it's actually the
season.
environmental seasons.
Absolutely. And we don't understand it completely. We're learning about it. It's more common in women than in men. And it usually starts manifesting in like late teens, early adulthood. But it's a temporary depression typically, and it occurs at the same time of year for the individual each year. And it most commonly manifests itself, like I said, beginning in the fall and going through the winter months, and it tends to remit or lessen when spring and summer. But there have been cases that they have documented where it's the reverse, where people actually have seasonal affective disorder in the summer months. So, we're
Interesting.
still learning about it.
It's also interesting that the acronym for that is SAD, S-A-D.
Yes,
right.
Yes, indeed.
What kind of treatments are there for seasonal seasonal affective disorder?
Well, you want to shed a little light on the topic.
I purposely put that in because and thank you for mentioning that because that is part of the treatment, is it not?
That is exactly part of the
Absolutely.
treatment. It's called phototherapy, and it has to do with these light boxes, which are full spectrum fluorescent lights, and these light boxes mimic the absorption of the specific spectrum of the sun on a sunny day. And so people will use these light boxes when they're working or at night, and that will diminish the symptoms of seasonal affective disorder. But the other thing to do, of course, is to go outside and experience some real sun when you can. When you're able to do that, that's always a good thing to do. And also, the use of antidepressants has been found to be helpful with seasonal affective disorder as well.
The other thing to comment further on going out and getting natural sunlight is you're also going out and getting some fresh air
That's
usually,
right.
and you're walking and getting exercise, and you're releasing a lot of those, natural, the
Endorphins.
serotonin and the endorphins, and feeling better, by just doing things that are good for you.
Exactly.
Let's say that someone has recognized that they need some assistance. What kind of factors then would impact their decision to seek assistance or not seek assistance?
That's a really good question, because we live in a society, as you know, that really admires and encourages independence. Shake it off, walk on, don't ask for help. So a lot of that has to do with whether or not people feel they have permission to say, you know, I'm really struggling here. I really need some help. It's a tough thing to do, and sometimes that's tough, particularly for, you know, military folks. I've got a big poster in my office that says it takes the courage and strength of a warrior to ask for help. And I love that, you know, and it's there when folks come in, because it does take a lot of courage to ask for help, but help is there. Folks need to know that, and as we've discussed here, there's a lot of different therapies and medications and just practical things you can do. It's available, and you know, call and let us help you get connected with those services. Yeah, reach out, absolutely.
Are there cultural, economic, and ethnic disparities in terms of someone's decision to seek assistance?
Unfortunately, there are. What we know from research is that people of color tend to seek mental health treatment less frequently than Caucasian counterparts. People of lesser socioeconomic means have less access to healthcare treatment and also have more difficulty paying for it, so it affects them. The elderly are an underserved population because they're also on a fixed income, and they have mobility issues sometimes. It's hard for them to get to a therapist to get help. And believe it or not, men are an underserved population. Often, as you said, men feel I should solve this problem by myself, and they don't reach out to get the help.
You know, we tend to feel men in our late teens and early 20s that we're invincible, and I think that sometimes that lingers on much too long in our later years, and it makes it difficult for us to recognize our vulnerabilities. Before we completely run out of time, I do want to make sure we get some contact information from the both of you. Lynn, if you could please give us some contact information for yourself.
Well, I am at the Hampton Veterans Affairs Medical Center. I guess my number on the screen.
Yes, yes.
So
you don't know your number?
No, I just did.
Okay.
I'm sorry. 722-9961, extension 1490, and you can contact me by email. And if you forget my name, you can call the VA's main number and just say, I want to talk to the suicide prevention coordinator, and they'll hook you right up to me.
Fantastic. And Dr. Ross?
Yeah, I'm Dr. Lawrence Ross, and I'm the clinical director of Affiliated Clinical Therapists, which is on 142 West York Street in Norfolk, Suite 710. And also I'm a co-host of the show Mind Matters, which you could find Sundays at 6 at www.toginet.com. And also it's a free podcast in the iTunes podcast section. Just look for Mind Matters.
And that's every Sunday at 6 p.m.
Every Sunday at 6. We've done about 150 shows. If you go to iTunes, you could see all the shows that myself and my co-host Joan Duhame have done.
Well, guys, I want to thank you so very much for coming on and talking about this critically important issue during the holidays. Any last words very quickly? You know, as I say.
I have a request. I'm hoping that we can put up the Veterans Crisis Line number on your screen.
Yes.
Because that number is a place where people can call 24/7, 365 days a year. Right. You do not have to be suicidal to call it. If you just need to call and talk and vent, you can use that number, and there's folks there that are happy to help.
Well, thank you so very much for making sure that we include that. And I want to thank you both for coming on to the show. Again, this is a critically important topic during the holidays, and I am hopeful that anyone that might find themselves alone and dealing with issues of depression and stress during the holidays will get some insight from this particular show. Thank you so very much.
Thank you.
Thank you,
And of course, we want to thank you for joining us today. Remember, you can watch previous editions of Health Watch online at www.norfolk.gov. If you'd like to drop me a line, you can email me at terrence.affer-anderson@vdh.virginia.gov. Please also feel free to give me a call at 757-683-8836. For the Norfolk Department of Public Health, I'm Terrence Affer Anderson, and this has been Health Watch.